अस्सलाम वालेकुम। हम आज का अपना लाइव सेशन जो है वो स्टार्ट करते हैं, जिसमें हमारे साथ जो गेस्ट हैं वो मोहम्मद उस्मान अहमद हैं, जो फाइनल ईयर किंग एडवर्ड मेडिकल यूनिवर्सिटी के स्टूडेंट हैं और रिसेंटली इन्होंने अपना स्टेप 2 जो है वो क्लियर किया है। तो ये स्टेप 2 के हवाले से स्टूडेंट्स को जो है वो गाइड करेंगे। तो मैं दावा देता हूँ उस्मान साहब को कि वो आएँ और इस वाले से जो है वो गाइड करें स्टूडेंट्स को।
जी अस्सलाम वालेकुम शिराज, अभी आवाज़ क्लियर आ रही है मेरी?
जी जी, आवाज़ क्लियर है आपकी,
जी
आप शुरू
चलें,
करें।
बिस्मिल्लाहिर्रहमानिर्रहीम, शुरू करते हैं। जैसे शिराज ने बताया, मेरा नाम मोहम्मद उस्मान अहमद है एंड आई हैव रिसेंटली डन माय USMLE Step 2. So we will try to hold interactive session so that you can learn some important information that may help you in USMLE exams. So I will give a brief overview of the examination and the process, and after that you can ask some questions that will be answered in the end. So in the end of the day, so that you are able to learn some important things that are helpful for you. So let me give a brief overview of the process and the exams. When we talk about specific, let's first talk about step two, and in that, if we get some time, we will discuss the other important things too. If we talk about USMLE Step 2 examination, the first important thing, the subjects. If we discuss the subjects in this examination, the subjects are surgery, medicine, gynecology, pediatrics, your psychiatry, biostat, ethics, and infectious diseases. These are the few important subjects that are included in the syllabus of the USMLE Step 2. These are usually taught in the final year MBBS in Pakistan. So these are the basic overview of the subject. We will discuss all these things in detail in the coming minutes. There's one more important question that is often asked, that whether we should do step 2 first or step 1 first. So if you're undergraduate, then definitely you will have to do step 1 first, because the basic knowledge of step 2 is based on step 1. So if you have done your step 1 for first aid, it will help you a lot in the basic concepts of step 2. So in case if you are graduated, then there can be two pathways. I have seen some people who are graduated, who had studied medicine, gynecology, pediatrics in their final year in their degree. So they did their step 2 first. But so if you are graduated, you can do your step 2 first too. But the easiest pathway is that you do your step 1 first. That will build your basics, and after that you start step 2. Then briefly discuss about the resources that are used and that are commonly used in step 2 examination. I hope I won't miss an important resource. The first and the most important, uh, uh, the resource that is commonly used is UWord QBank for step 2 examination. So the UWord is a most commonly used tool that helps a lot of information, the basic knowledge, the tables, and a lot of other things, algorithms that are commonly for step 2. So the most important thing is UWord. And the second important thing is Anki flashcards. You make the flashcards of all those things you read in UWord. You make flashcards of these to revise in the end. So it's basically a revision tool, Anki flashcards. There's also one more thing that is called inner circle notes, or other sort of notes, any sort of note. There are lots of notes that are available in the websites. So I personally didn't use these inner circle notes, but there are a lot of people who are using in these months. These are also basically like anti flashcards. So the basic knowledge that is in notes form, people do that. And after that, we discuss one of the most important thing. If you ask me, I would say that was one of the most important thing that boosted the scores. That is Ambo's Q bank. That is very comprehensive question bank that discusses a lot of questions. So Embo's QBank that has almost 3,000 questions, and it's along with that there is Embo's library. Embo's library has a lot of knowledge, a lot of articles in it that discusses the management, the diagnosis, and all the pathophysiology. All the important steps are discussed in a well tabulated form, so you can use that. That's a very important tool. Ambo's QBank, and specifically a library of the Ambo. There's a lot of knowledge in it. After that, there comes some resources like NVMEs, and your assessments that are basically assessment tools that has almost 200 questions. You solve them, their exams to assess where you are standing to go for exam or not. After that, there are CMS forms that are also used for revision purpose, and there is one more thing, divine intervention. So these were the commonly used resources. Let me devise them. The first I discussed UWord, after that Anki flashcards, some sort of notes, after that Emboss QBank, Emboss library, and there is also NVMEs, USA's CMS forms, and divine intervention postcards. If we explain all these resources one by one, then first comes the UWord. UWord has almost 4,000 questions in it, and each questions has a lot of explanation of all of its concepts, all of its options. So you have to solve those 4,000 questions in your first attempt. So these four, how much time it may take for completing your first pass of UWord, it varies up to 3, 4, 5 months, depends upon how much time you spend on it. Uh, it would talk about how to solve the U word. That's also a technique people ask whether we should do random or whether we should do systemized. So I will tell you about the both these things. I did in a random mode, but in a random mode, the first 20 means all the subjects you did in a random mode. So in random mode, the first 20 to 30% is really difficult. There are a lot of new questions coming all the time. There's no revision at all. So, but after you have done this 20%, 30%, the questions start coming with revision. So it helps a lot in the concept building. So I did random keyword, and I recommend to the people who are starting to do random to have a comprehensive overview of the intercorrelation between the concepts. And the second thing is system wise. You can also do system wise, doing one system after other, one subject and after other. So the but better it is if you do it in a random mode. So if you start one block of your word, how would you solve it? If you talk about step two compared to step one, it's a bit difficult in relation to its questions and concepts. So it will take a lot of time compared to step one. So it may take almost one whole day to solve your one block. You read one question, so you have to pick its information. You have to see why the other options were not correct. So you have to read the tables or algorithms, you have to save them, and after that you have to rule out other options. This is how you solve a question. A block has 40 questions in it. So the time for solving your may be almost on average 3 months. If you solve one block each day, it may ends in 3 months to 4 months maximum. After that, it may take time that may be variable depending upon how much time you spend on it. Like it may be 6 months, 14 months, 12 months, 8 months. There are a lot of people who take exam in 6 months. There are few who take in 8 months, 10 months. It depends. It varies from person to person. Some people are quick learner, they have a short-term memory, so they can do in 6, 7 months. Otherwise, it usually takes a time. It's difficult exams compared to others. So after discussing the time for exam, we discuss the pathways that you usually have after your UWord. You solved your UWord first pass. You're standing here. Now you're thinking, what would you do? It may vary depending upon your performance. It can be you can do the second pass of the UWord. You can do Anki. You can do other notes for revision depending upon your scores. So after UWord, you give an assessment, you see the scores, and after that, you see if they are very low, it's better to do the second pass of the UWord. You do the second pass, you revise again the same things that you are very weak in the concepts. So there will be 2, 3 pathways. Second pass of UWord or UWord wrongs. The other can be Anki or notes for revision. So basic thing is you have to improve your scores in assessments to go for exams. If you talk about Anki deck, how to use the Anki deck, sorry, Anki deck can be used in study mode or preview mode. But I would recommend you to use in a study mode. What is study mode? That you see a card, there are few options coming in it. Like if you have a good approach on the card, you can mark it in the easy category. It will appear after many days. But if you mark it hard, it will easily come after a few minutes or few hours. So that's the study mode of the Anki, and there is other one called preview mode in which you just see the card and pass it. It comes in next in the next VM. So so you did the U word, you revise from any of the tool you were using like U word or Anki. After that, you can go for your emboss cubing and its library. Library has a lot of knowledge. I would recommend you to use the library if you are doing step two, and then improve your scores, go for exams. If we talk about the basic keys for the exam to boost your score, I would recommend, according to my experience, there were two, three things that were very helpful. The first one was a very good revision. To memorize all the things, all the algorithms, all the tables, all the data, you cram it. That's one of the important tools. And the second is a lot of questions, lot of practice. I solved, I must have solved a lot of questions like say 7, 8 thousand or more. Like so, I solved full UWord, full Ambos, all the NBMEs or other questions I found from any tool. So the basic is a good revision and a lot of questions. And you go to the exam on exam day. You are confident that you will score good. That will help you boost a lot of your scores. We will discuss some other things like pattern of the exam. There are 8 blocks, 322 questions. You can schedule accordingly. Whenever you book your exam, when you are full prepared, you better go for the exam. Like when you are scoring in good scores according to your expectations, then book the exam. So if you talk about how much time we should spend on preparation during the day, so I would suggest to spend the maximum time is really lengthy and difficult exam. It takes a lot of months. So try to end it as soon as possible. Try to spend 6, 8, 10, 12, 14 hours you get from your time. Uh, you can divide it in portions of the day, like 3 to 4 hours in the morning, 3 to 4 hours in the evening. How you use 1 hour? If you have 60 minutes in hour, you can study for 50 minutes. You spend 5 to 10 minutes in a break. So that will be very helpful. So these are the basic techniques that help you to prepare for the exams. So the basic, if we talk about the basic concepts of self-improvement in the examination process, because it's a long journey, you get overwhelmed with the passage of time, like you think you are not improving, you get depressed. How will you overcome that? So we talk in medicine, a very important concept, PDSA, plan, do, study, and act cycle. If you are not improving in your scores, identify the cause. Why you are lagging. First, you sit and identify the cause, what is basically causing the discomfort. After that, make some plan accordingly that how it get solved, and then act on these plans and again analyze. This is how you spend your week. You analyze your mistakes, you analyze your weakness in study, in your schedule, in your discipline, in all the things. After that, you analyze those, and then after you try to improve. So this was a brief overview of the step two and all the things I discussed, and other things can be answered according to your questions. Post if you have posted. Shiraz Ali, is there any question? I don't see any here.
If you have any question, you can ask in the comment box. If you have any question, kindly comment on.
कोई क्वेश्चन नहीं है अभी?
I guess so. There is no question. I'm
अच्छा, मैं
thankful
फिर कुछ
to.
और बाकी थोड़े प्रोसेस का ओवरव्यू देता हूँ, 5-7 मिनट फिर एंड करते हैं सेशन को, ठीक है?
Okay.
स्टेप 2 की हमने जो है मैक्सिमम चीजें हैं वो हमने डिस्कस कर ली हैं। आगे हम स्टेप 2 की स्टेप 1 की बात कर लेते हैं, और जो बेसिक चीजें होते हैं जो स्टूडेंट्स को अक्सर पूछते रहते हैं, उन्हें क्या इश्यूज होते हैं। तो द फर्स्ट थिंग कि स्टेप 1 की अगर बात की जाए वो कब स्टार्ट करना चाहिए। स्टेप 1 का अगर स्टूडेंट्स ने उसका बेसिक क्राइटेरिया ये होता है एग्जामिनेशन स्टेप 1 का कि आपने जो बेसिक एजुकेशन अपनी यूनिवर्सिटी की जिसमें आता है फर्स्ट सेकंड ईयर की, जो लाइक बायोकेमिस्ट्री, फिजियोलॉजी, इस तरह के सब्जेक्ट्स आपने क्लियर कर लिए हुए हैं, तो उसके बाद आप एलिजिबल होते हैं एग्जाम्स बुक कराने के लिए। तो अगर तो आप अंडर ग्रेजुएट हैं और आप थर्ड ईयर के सेशन में आते हैं, तो ट्राई टू स्टार्ट it as soon as possible from the very first week, very first days of third year. That will help you a lot in your discipline. If you delay it, it will get a little overwhelmed. So the important thing is you start in the very start of third year. So if you are in fourth year, you haven't yet started it, then start it right now. If you are final year, if you haven't done it, then start right now. So if you ask about step 1, I will say start right now. The basic things we study in step 1 are resources. If we talk about resources, these are the most commonly used resource in the whole world is first aid USMLE step 1. That is a comprehensive book for step 1. Uh, the most important is first aid. After that, you use the question bank. Question bank most commonly used is Eword, but there is also some people who use Emboss too. So you solve the question bank, you read the book, you do revisions. After that, you go for exams and you get appropriate scores. That was the overview of the step 1. So आगे कुछ डिस्कस करना है या एंड करना चाहिए फिरोज जी?
एक सवाल है जी, हाउ टू अचीव मैक्सिमम स्कोर इन स्टेप 2?
हाउ टू डू मैक्सिमम स्कोर, ये मैंने एक चीज डिस्कस की थी कि देयर आर 2 to 3 things. Like first thing is a very good revision. You have a full grip on your basic knowledge that is in Word or Anki. That is first important thing, that you have a full grip on algorithms or all the tables. The second thing is do a good practice of all those. Solve a lot of questions. I told you I solved 7 to 8,000 questions, especially in the last month. I used to solve 4 to 5 blocks daily in the last 20 days. I remember. Uh, so if you have a good reflex on questions, that helps you boost your questions. And the other thing is there are a lot of students who get panic in the exam, that decreases your performance, the confidence on you that you have studied very well in the last few months. In you spent 7 months, 10 months, whatever. You did a lot of work. You sacrificed a lot of things, a lot of family functions, a lot of things. So you must be confident when sitting in the exam. You must be like you are sitting in your own home, your own study table. That helps you boost question. That help you boost your scores. So a good revision, lot of questions, and confidence. That's all. Any other question?
एक और सवाल है जी, मिनिमम हाउ मच टाइम वी नीड फॉर स्टेप 2 प्रिपरेशन?
Minimum time 6 months almost.
If we
I have
if
seen
we push maximum, how early we can do step 2?
6 months. 6 months. You will take almost 3 months on your word completion. After that, you spend on revision. Minimum, it will take 5 to 6 months. But Yeah, according to my experience, I've seen people did in 5 to 6 months early as possible, not more before that.
एक और सवाल है जी, can we use first aid as the main book or not?
Uh, if you have done your step one, you are basic knowledge. For step two, no, there is no book recommended. If you you're talking about the first aid for USMLE step two, is I have not seen any person in the last 2 3 years who have been using this book. No, so the important tool is just keyword. So no need to do the book. If you have weak concepts from the first state of USMLE step one, you can read it in the near your exams to refresh your knowledge, but no need to do the step two any book of step two.
There is another
Okay.
question, can we do 2 blocks per day? Does it will affect our preparation or not?
अगर तो आप 2 ब्लॉक्स आप सॉल्व करना बहुत मुश्किल काम है. स्टेप वन में हो जाते हैं, लेकिन इफ यू टॉक अबाउट स्टेप टू इज डिफिकल्ट बिकॉज अ लॉट ऑफ नॉलेज इन इस वन ब्लॉक. लेकिन अगर आप ऐसे कर रहे हैं कि जल्दी जल्दी में एक ब्लॉक को आप रिव्यू अच्छा नहीं कर रहे और दूसरे की तरफ जा रहे हैं, तो आप बेसिकली आप सही नहीं कर रहे, फिर आपको बाद में सफर करना पड़ेगा रिविजन्स में. तो मतलब अगर आप अच्छा कर रहे हैं अगर तो आपको वो डाटा रिटेन है ब्लॉक वन का, तो ऑब्वियसली कर सकते हैं, लेकिन अगर नहीं रिटेन तो फिर नहीं रिकमेंडेड. तो आप एक ब्लॉक अच्छे से रिवाइज कर लें, उसके बाद अगर टाइम मिलता है तो डेफिनेटली अगर आप शॉर्ट टर्म आपकी मेमोरी इतनी अच्छी है रिटेन करने वाली, तो डेफिनेटली जाएं, दूसरे ब्लॉक की तरफ भी जाएं. जी आगे.
There is another question. If someone wants to attempt step 2, which books he should study in the final year of MBBS?
If you want to do, can you
If you
repeat it?
want to do step 2, most probably he want to ask for after graduation. If you do step 2 after graduation,
Okay.
which books you should study in final year?
You can study any books, it doesn't matter much. But mostly people, if you talk about step, you have heard of step up book for medicine. It has some resemblance with the U word, so you can use step up book for medicine, and any other book. It doesn't affect much. ये इसका थोड़ा सा अलग गाइडलाइंस हैं, तो इतना अफेक्ट नहीं करेंगी इससे. बुक्स जो भी आप यूज कर लें, क्योंकि मेडिसिन तो वही है तकरीबन सब में. जी नेक्स्ट.
I guess there are no more questions. And
Can we
yes,
use
would
if
like to know. These are previous questions. So thank you, Usman Bhai, for guiding the students and conducting this session fully.
कोई मसला नहीं,
I
वेलकम
hope so it will
वेलकम.
benefit the students. चलें,
चलें
इसको हम
ठीक
एंड
है जी.
करते हैं. जी शुक्रिया,
अल्लाह
अल्लाह हाफ़िज़.
हाफिज़. अल्लाह हाफिज़, शुक्रिया.